Welcome to our first event for Midwifery Week, our first Frontier Nursing University event for the week, Empower 20, the year of the nurse and the midwife. I have the pleasure of introducing the speakers to you tonight. I'm Tonya Nicholson. I'm the Department Chair of Midwifery and Women's Health at Frontier University. And I am my friends here today. I'm Dr. Jeneen Lomax. Jeneen, you want to give a big wave so everybody knows who you are? Jeneen is a faculty member at Frontier and a certified nurse midwife with over 19 years of women's health experience. She is a three-time graduate of the University of Illinois at Chicago, earning a Bachelor of Science in Nursing, Bachelor of Science in Nursing, and a Doctor of Nursing practice degree. She worked in several different practice settings, such as community hospitals and academic hospitals, private practices, and federally qualified health centers. Prior to her faculty appointment at Frontier, she has had the pleasure of working as an assistant professor teaching several graduate level courses in an FNP program, ranging from advanced pathophysiology to women's health therapeutics and management across the lifespan. Dr. Lomax has been a clinical preceptor for RNs, APRNs, and medical students for more than 10 years, as well as teaching resident physicians the management of low-risk obstetrics and family planning. As a full-time faculty at Frontier, she has taught the role of the nurse-midwife and women's health and is currently the course coordinator for the comprehensive final exam review course. And she is one of our clinical team leaders, and I'll tell you, Frontier. Her goal as an advanced practice nurse, nurse-midwife, and academic faculty is to uplift and empower others to reach their greatest potential. Thank you, Dr. Lomax, for being with us. We also have some students with us today, and I'm going to tell you a little bit about them. Jamila Webb. Jamila, you want to give a wave to everybody? Jamila is a first-year nurse midwifery student at Frontier, and she is also a registered nurse, certified doula, and writer who's based in New Orleans. She is the founder of Her Health Nurse. Now, what is that, Jamila? You want to tell us what that is? Oh, you're muted. There you go.
Okay, yes. So my public health background started in STI testing, treatment, and I used to work with HIV positive individuals. When I moved to New Orleans, there is no standardized sex education. And because of my temperament, I would treat a lot of young people and folks with special needs for STIs. And so I ended up coming up with Her Health Nurse, which stands for Health, Education, and Reproductive Justice. And sometimes folks would reach out to me to come to like schools, after school programs, in different colleges and things to talk about HIV, AIDS, and STD prevention. So it slowed down a lot, but it was really my joy to do community health outreach in that way.
Thank you, Jamila.
Mm-hmm.
Travel, read, listen to indie hip hop and jazz, and is beyond passionate about young women's health. She currently works as a labor and delivery nurse and is an associate editor with Anti-Gravity magazine. Sunny is not able to be with us. If she jumps in later, which she might, then I will we'll come back and introduce her at that time, but she's had an emergency on the workplace setting. You all know how that is right now. Erin, you want to give a wave? Erin Hanks is a registered nurse and a nurse midwifery student at Frontier. She's from Charlotte, North Carolina, and has been a bedside nurse for 18 years, with that time in NICU, labor, and delivery. And while she loves all aspects of women's health, the fourth trimester holds a special place in her heart. She and her husband, Eric, have 3 kids who keep them busy, especially now with remote learning, and we have a lot of empathy and sympathy in those areas for you. And a big old senior dog named Timber. Thank you, Erin, for being with us today. Is everybody survived today at school? All your kitties survived today?
They did, but I'm hiding in the bedroom. That's why I look.
That's okay. Hey, we're glad you're here. We won't talk too loud. They won't hear us.
Yeah.
And our last panel member this evening is Sharon Appleton. Cheryl, want to wave to everybody? Cheryl is a registered nurse and a nurse midwifery student at Frontier, and is just a little wee bit Frontier as a second career nurse with a background in both labor and delivery and maternal fetal medicine nursing. Cheryl's experiences working with low-income, low-resource women in Baltimore, Maryland are what inspired her to become a nurse midwife. and she is looking forward to serving this population. Her activities outside of Frontier include working with ACNM's National Government Affairs Committee and Affiliate Development and Support Committee, and serving as her class Midwifery Student Council representative at Frontier. Cheryl, thank you for being with us. Do you want to tell them what ACNM is? We use a lot of letters, you know, and sometimes we don't tell everybody what it is.
So yes, I would. ACNM is the American College of Nurse-Midwives, and it's kind of the big organization for certified nurse midwives, and there are others for different types of midwives as well. But we're all inclusive. We love everybody. So yeah, they are the national organization, and the committees that I work on. One is the National Government Affairs Committee, and that is geared towards helping to shape legislation and to help get legislation updates and information about them out to other midwives and to the public. And then the Affiliate Development and Support Committee is more for each of the state affiliates, just trying to help them in any way that we can. Some are obviously doing better than others. That's just the way things roll. So maybe passing on ideas, that kind of thing, just to kind of help them out. So it's a nice way to stay in touch with everybody everywhere.
Thank you, Cheryl. So as you can see, we've got a great panel here. We have students from all different parts of the program, and then Dr. Lomax and I, and we're so glad that you're here. So you're in the right place if you are interested in anything to do with midwifery, either becoming a nurse midwife, a nurse midwife student, if you're already a student at Frontier or anywhere else and you just want some tips on being a successful student. And if you are just wondering, what is a midwife? Maybe I want to be a midwife. What should I do if I want to be a midwife? So you're here at All Things Midwife tonight. So the mission of Frontier Nursing University is to provide, sorry, I'm over the top of my slides here, is to provide accessible nurse midwifery and nurse practitioner education to prepare competent, entrepreneurial, ethical, and compassionate leaders in primary care to serve all individuals with an emphasis on women and families in diverse, rural, and underserved populations. I hope that as you hear that, maybe it spurs something in you, maybe it resonates with you, because everything that we do, we come back to this mission to decide if we're moving our mission forward. So if you want to be a part of Frontier, we're going to ask you to sign on to this mission.
I was muted. So I would like, for our student panel to just share with our audience where you are in the program. And I really want you to think about one piece of advice that you would offer a potential student, and kind of think about something that you wish someone had told you prior to beginning your midwifery journey. I'm not going to call on you, but I want to hear from everybody. Okay, Cheryl, I'm looking at you.
Uh-oh, I'm on the hook. All right. So I'm towards the end of my student nurse midwifery journey. I'm in my clinical rotation right now, which is why I look like the cat's pajamas. I apologize to everybody, but I'm on call right now, so this is how you get me. Sorry. So I have loved every minute of my journey. It has not been an easy journey, for sure. It's definitely a challenge. I feel very well supported and have always felt very well supported by my peers and by the faculty. So, I mean, I just can't complain. I feel like it's gone really well so far, but it hasn't been easy. I think the one thing that I wish that I had known, I expected it to be difficult. I did. I guess I didn't realize how much it would consume my life. And it's not a bad thing per se, because it's just that I'm starting to think about it all the time in everything. Everywhere I go, I think that person could use a midwife, or midwives could get involved in that, or, it just kind of starts to permeate everything that you do. So I feel like I don't stop thinking about it now. It just kind of is everywhere. So, I mean, it's not a bad thing, but it definitely becomes part of who you are. And it definitely is, yeah, it's pretty consuming, not in a bad way, but pretty consuming.
It's your metamorphosis. You're becoming a midwife, and that's what it's all about, because that is going to be your life. Good. Thank you so much, Cheryl. Erin, what could you share?
So I just finished my clinicals about 2.5 or 3 weeks ago. And I will say this, and I just started the comps course with Dr. Lomax. Today's day one. So I will say this. So I can't, I will say from clinical bound on, I felt like be okay with a shifting perspective, and it kind of, I don't know, your outlook changes. So going into clinical bound, I was like, okay, I'm ready. I'm done with all my courses. Let's go. And then leaving clinical bound, I was like, I really have to sew a real perineum and not a foam block. And then once I got into my clinicals, I got not comfortable by any means, but a little bit like, I got this with my preceptor. And okay, we're doing this. And I got another birth, and my, just my where my hands are, and my suturing and things, and in the office. And then towards the end, I was like, oh, I have to leave her. Like, I'm gonna have to do this on my own. I'm not okay with this. And now with comps coming, I'm like, I have to take boards, and I have to actually put everything I've learned. I'm not ready for this, even though I do feel like I was, like Cheryl was saying, I feel well prepared, but just be okay. And I still am, this is ever evolving for me, but my piece of advice is be okay with a shifting perspective, and knowing that it's going to change with each step you get. I feel like I've gone up on my learning curve and my graph, but now I realize that the graph extends, and I'm like, oh, it keeps going up. I have more to learn.
Excellent. Yes. Yeah. It's the transformation that's taken place, and that transition from nurse role to midwife role. Very good advice. Jamila?
Hey, everybody. So I would just love to piggyback off of what Cheryl said in terms of it being all-consuming. So this semester I'm taking epidemiology and biostatistics, and I actually took an academic hiatus this summer. So my advice would be to pace yourself, and it's okay if you don't come in the program and finish in 2 years. Prior to starting this journey, I was in public health for over 10 years. I'm used to writing on the side. I'm used to doing community outreach. I'm used to having my hands in all these different pots. But after I started school, and once someone told me I needed labor and delivery experience on top of my classes, on top of COVID happening, on top of the Black Lives Matter movement and different things which have impacted me as an African-American woman, on top of the burnout and turnover on my unit, my dad is ill now. Like, it's been so many different things happening in my life at once. And I asked myself, how do I balance this? I've humbled myself and started all over from scratch, I feel, because being in a clinic and office setting in a GYN is totally different from being on a labor and delivery unit. And so I found, for me, the easiest way for me to do it is just to pace myself. I want to make sure I learn as much as I can on the floor. I want to get used to the flow of that. I'm on night shift right now, flipping back and forth between being up during the day. It's just a lot. So I've just really learned to pace myself and be okay with going part-time. I want to make sure that I'm learning as much as I can along the way, and not just trying to fly through at the end and say, oh, I'm a midwife in 2 years, I'm ready to do this. So I'm just really humbled, constantly in a learning mode, and saying it's okay if I can't do all those 15 different things at one time that I was used to doing all the time.
Very good advice. That's a piece of advice I wish I had received, and that's to be flexible and to be patient, because this journey to midwifery, it's a marathon. It is not a sprint. And so you do have to pace yourself and allow for flexibility. Good. Thank you.
Thank you. Always, I appreciate those words from the students. You're so right. Pacing yourself, giving yourself the flexibility to be up and down and grow in new ways, and to be consumed by something new. Some of those things are never going to leave, because you're changing, and that's going to be a new part of who you are. Cheryl, if I see somebody out, I think, oh, she needs a midwife. And I'll tell you that it extends to your family too. Your kids think that everybody's supposed to see you, your spouse, your family, your friends, they all think so that's, the good and the interesting of it. I put this slide up because I want you to, on the right there, for those of you who are not as familiar with Frontier as some of the other folks here might be, this is an old historic picture of Mary Breckenridge, who founded the Frontier Nursing Service and the Frontier nurses at that time. And what I'll say about the comment on the left, midwifery, any advanced role, your nursing role, those are careers. But when your career and what drives you, what makes your heart sing, when those things come together and you're able to do it, to do in your career what your heart tells you you want to do as well, it does make it all consuming, because all of a sudden it's more than just a job. It is an integral part of who you are. And that is, I think that's such an important part of becoming a midwife. So if you're thinking about, if you're on this call and you're deciding if you want to be a midwife, think about the things that really make you, that you're passionate about. Most of us could choose many, many jobs and be perfectly fine, successful in them, do well, make a good living, but live a mediocre existence. And if you have the option to live an exceptional existence because you're doing what you love, then that is, that's what I would advise you to do.
Yes. And we know many of you that are, really kind of thinking about this midwifery journey and trying to make the decision if this is the direction that you want to go in, you're being pulled this way, but you might approach this with some trepidation or some uncertainty. But we want you to know that we have absolutely no doubt that you probably already possess the characteristics required to be a midwife. But if not, going through this journey, we are certain that you all will be smart, you will be compassionate, passionate, honorable, supportive, caring, dedicated, wise, and patient expert midwives that will advocate for your patients, practice evidence-based care, and provide top quality care. So we want to thank you for looking to midwifery, because this is a beautiful journey, and we know that you all possess everything that it will take to become a midwife. So thank you for what you're trying to achieve.
I'm going to just give you some of the nuts and bolts of, if you're sitting here and you're not a Frontier student, you're considering becoming a midwifery student, for Frontier, and this is one of the only things that we're really there are only a few slides that are very Frontier specific, but we want to give you the opportunity to learn a little bit about the way that we approach midwifery education. We have 3 degree options. So we have a master's degree, we have a postgraduate certificate for folks who are already, say, an FNP or a psych mental health NP. You can add another population focus on with midwifery. And we also have a Doctor of Nursing Practice. To get the MSN for midwifery, and that is what is currently required in the United States, it's a master's degree. You come in with your bachelor's in nursing, and it takes 2 to 3 years in the programs that we have established to get the MSN. If you're a postgraduate student, so you're already an advanced practice nurse of some sort, you can add midwifery on in anywhere from 1 year to 1.5 years. And then after that, if you would like to add the Doctor of Nursing Practice on, you can do it with actually even more options than this. 12, 15, and 18 months is what I have listed. But really, it's very flexible so that you can start your practice as a midwife and continue to pursue your doctoral degree if you would like to do that. So I want to ask the students another question. Life as a midwife or a midwife student. So I've got up here who I think, a good quote that I think describes who a midwife is. A midwife should have the hand of a lady, the eyes of a hawk, and the heart of a lion. And that speaks to me even in today's society. It's an old quote, but to me it talks about the gentleness with which we approach the care of the people that are in our service. And then the eyes of a hawk, we're watchful, waiting. A lot of our job is about watching and not using our hands, but watching and thinking and not using our hands until they're needed. And then the heart of a lion, to advocate for change, to advocate for the people that you care for. But to get there, what does it mean to get there? And Jamila talked a little bit about that flexibility with yourself, saying no to some things, making some choices in your life to make space for becoming a midwife. But I want to ask you students, what would you say is most important to you as you're moving forward as a student? What things would you want the people who are considering becoming students to know right now? And it may be similar to what you talked about before, that's okay, but you can talk a little more about where you are specifically in the program and what lessons. So Jamil, I'm going to ask you early in about the lessons, and then Cheryl and Aaron, if you could talk about later in the program the things that maybe were surprising to you.
I'm trying to think about how to answer that without sounding redundant, but what did I learn early on in the program? I would just say being honest with myself, remaining humble that I don't have to rush through, and then once again, being flexible. And the reason why I say being flexible is because the week that I started on labor and delivery is the week that COVID broke out. So when I tell you, like, my orientation was chaotic, the world was chaotic, you know, I'm exhausted because it was night shift. It's just like, what's going to happen next? We don't know. But having that confidence that I have this foundation, I'm here for a reason, I'm going to take my time and pace myself and endure. So, you know, I wish I could say more, Tonya, but that's the only thing I can think of. Just being okay with the unknown, but knowing that you're here for a reason, that thousands, if not millions of women before us have taken this role, and having that supportive community does make a difference. My family's very supportive, and then I do have classmates and things that I lean on for encouragement. So I would just say having a good support system and community as well.
I think, Jamila, you really hit on something important there, and that is that support system that consists of people within school, but also from without as well. So your community and your family. Cheryl or Eric?
So again, not to sound redundant, but I agree 100% with everything that Jamila just said. I think that it is important to have your support system, and your support system is so much bigger than you know. I have gotten support and encouragement from people that, I mean, just people in my life, random people who said, yeah, you're doing this, aren't you? Well, good for you, and keep going. And, you know, I mean, it's really great to hear. I've had a lot of, you know, just people that I wouldn't have expected be very big support. So that's great. You know, having your family on board is always helpful. And then also, as Jamila said, to kind of roll with the punches is really important. You know, nobody expected COVID, and here we are. You know, I just did my clinical bound back over the summer, and it was an online experience, completely different than what I was anticipating when I started the program. No, who knew this was all going to happen? And it ended up being great. It ended up being very connecting with my fellow peers, and we have our own Facebook page now where we all still communicate and say, do you know what you're doing for this assignment? I don't know what I'm doing with this assignment. You know, we're still kind of very close with each other. So yeah, just knowing that you can.
Cheryl, just to describe, can I describe a little bit about what Clinical Bound is? Because if we have non-frontier folks, they might not know what that is. The way our program is lined out, we do the first part, you come to on campus for an or you come online, because nobody's coming to campus right now, but we do an orientation that's a couple of days long. And then you do a year to a year and a half of didactic or book work that you do online, Some of it is synchronous, meaning that you're together in your classes, and some of it's asynchronous that you do on your own. Some of it you do with groups, some of it you do by yourself. And then we have a time prior to going into your clinical site that you come back together. We call it clinical bound, and that's where the clinical skills are taught. So it's like hand skills are taught and simulations are done to prepare you to go into clinical. So when Cheryl is referring to clinical bound, she's talking about that intensive clinical skill time that we work together. Dr. Lomax is one of our clinical bound team leaders, and that lasts for about a week before you go into your clinical site. So it's like a it's like a bridge almost between the books and the hands. So I interrupted you, Cheryl. Do you want to finish that thought, and then we'll see what Erin say?
No, and I'm glad you explained it, because I forget that people don't know our lingo. So, but just, yeah, it was really a wonderful experience, and it turned out okay. So even when things get in your way, even if you hit stumbling blocks, you know, unexpected life events, like Jamila said, you can always take a hiatus if you need to. Reach out to the faculty. Last year, unfortunately, my wife had a stroke. And I guess it was in October, and I really needed the support of the faculty, and they were amazing and helped me stay caught up and helped me to, you know, stay involved in things, gave me options, and it just turned out beautifully. So even when things pop up that you weren't expecting, it's still doable. So yeah.
And it's going to be redundant, but I'll say flexibility. I went to Clinical Bound in the end of January and had an amazing time at Hayden and was like pumped, and got into clinicals and did about 4 weeks and then got kicked out for 12 for COVID. But the bonus was I had to find a bonus, and it was I got to see people at like their first prenatal visit, and I got to catch their babies in September. So something that wouldn't have happened, but to have flexibility. I remember going, you know, you'll go to Frontier Bound, and in that, when you meet all your peers, and they talk about, oh, I'm going to finish this as quickly as possible. Oh, I'm doing 3 classes per term. I'm going to do this. I'm going to do that. I did not go full time, but some of my peers did. And, but some were forced out of that full-time track for various reasons. And I think just knowing that this is a journey, this isn't like point A to point B necessarily. And sometimes the sidetracks really lend to the experience of learning, and just not even just clinically, but in your coursework and with your peers, because it is a tight-knit community. So flexibility. Thanks, Jamila. I'll piggyback on you.
So I'm just going to point out the words that you guys used that I think are so critical. Flexibility, communication with your faculty, with each other, adaptability. And so you guys have really just hit so many of the things that, if I could just nail them down into your being, they're applicable in your educational journey, but also later in your life as a midwife. It's funny, Erin, you should say that about point A to B, because here's what our next slide is about. Yeah. Jeneen, did you want to speak to that?
Yeah.
So well. But
I mean, you all really hit on this slide. I'm just sitting here chuckling. I'm like, okay, we've already discussed the next slide. But, you know, I have this, my grandmother always said this saying to me. She said that, let me get it right. If you want to make God laugh, tell him about your plans. And that's essentially what this is all about. And you have to be flexible, and you can hear from our student panel that is what they have consistently spoke about: flexibility, adaptability, you know, changes that are happening. I mean, just imagine where we are right now. No one ever imagined that we would be in the middle of a pandemic. But our students have survived. Our university has survived. We really were flexible, and we were able to make changes to adapt to our current situation. And that is what it's all about. It's not going to be a straight shot to the finish line. Remember, this is not a sprint. This is a winding marathon, so you have to be mentally prepared for that and be able to go along with all of the punches, the obstacles. There will be barricades in your way, and you have to learn how to move around them. There will be hurdles to jump over, and you have to have the strength and ability to do that. So that is really what it's all about, because what this does, being able to deal with changes, because change is uncomfortable. You know, we have these plans, but when changes throw a monkey wrench in our plans, it's very uncomfortable. But look at both of these images. You still will reach the finish line. And it is not about how long it took you to get there. It is about the journey, and the journey is what makes you a stronger person. And our students just spoke on this like.
They sure did. They were perfect. Yeah. Tiara, do we have any questions pending right now for the students or for us before we move forward?
Not at the moment, but I'm definitely keeping an eye out for them.
You guys, please feel free to unmute and ask questions if you would like. So I'm just going to stop and say, are there any attendees here that would like to unmute and ask us a question before we move on?
I have a question.
Yes.
So I'm currently a nursing student in an ADN program.
Mm-hmm.
I'll be finishing in December, but midwifery is my goal, is where I'm heading. But I haven't had the BSN yet. And I know you used to offer a track that included the BSN. I just wondered if there was any chance of that coming back.
I've not heard of any plans to bring that back at this point. But what we found is that there are many ADN to BSN programs across the United States that are available. And so hopefully, you know, either if there's not an in-person one close to you, there are lots of online and distance ADN to BSN programs. And then that'll give you time to get some nursing experience as well, which you're going to need before you can come in. So that would be, you can use that time to gather your nursing experience and do your BSN completion. So, but don't give up your dream. It doesn't matter that was that plan thing. It doesn't matter if it's a straight easy shot. Most of us don't, it seems, midwifery seems to draw people that don't necessarily take the quick and easy shot. I think we like to gather our life experience along the way too.
Okay, sounds good. Thank you.
You're welcome. Any other questions right now before we move forward?
Yeah, I have one.
Oh, sorry, go ahead.
I heard one of your ladies started as a doula and then became a midwife. I was wondering, what are some of the pros of that? As a high school student, I'm working on becoming a doula right now, and I've got my eyes set on either midwifery or OBGYN.
Sure. Anything that you can do, which would include becoming a doula, that puts you in the realm of childbirth, that you're hearing the language, that you're getting a good look at what normal looks like. And that is the role. And the doula very often is supporting the normal childbirth, normal physiologic birth. And so because of that, you're going to have a nice picture and a nice foundation of what childbirth can look like and should look like. That will be very beneficial to you. And just being in and amongst people that are talking about birth and going to birth, that is beneficial to you.
Cool. Thanks.
Does anybody else want to speak to that question?
Sure, I will really quickly. So to give a quick backstory, so I've been in New Orleans for about 10 years. And when I first moved here, because I did HIV and AIDS in DC before I moved here. So when I first moved here, I did HIV, AIDS, and I worked mostly with gay and bisexual men. I really missed working with women and adolescents. And so I became a volunteer doula on the side. And once I became a doula and then transitioned back to working with adolescent girls and young women again, I loved it so much. And I think doula is a great experience. You learn about your comfort measures, getting mom up to the bathroom, a certain vocabulary, anatomy, and that's what really drew me into loving birth, period. So I was a nurse first, but being a doula just gave me an overall great experience, introductory experience into the birth world. So I think that's a great start.
Awesome. Thanks.
I was a doula before the word actually came about. There was an or the word was not commonly known. It may have existed, but the word was not commonly known back in, I'm not going to tell you how many years ago, when I was having babies. And that's kind of what led me to midwifery as well, was just being with women at their births. And so,
Yeah.
I think somebody else maybe had a question too, at least one more. We'd love to take more questions.
Yes, I have a question. I currently already have an MSN in nursing, and I was looking at the programs of study, and I'm noticing again that it is different from, you know, what I did. But when you look at the 24-month versus the 30 months, for those that are currently in it, what are the pros and cons of the 24 versus the 30 months as far as completion?
I will just say I did the part-time, and for me, I was working full-time, and it was plenty to do. I definitely, if you're planning on working at all, I wouldn't recommend doing the 24-month at all. It's just, I feel it's too much going on, particularly if you have, I don't know if you have family or other folks that are, you know, taking up space in your heart and in your life. That makes a difference too. I think that working full-time and doing the part-time track is a really good match. You know, kind of doing it as it comes, but I wouldn't, if you're going to work, I wouldn't do that's just my.
Okay, so I recently graduated in May 2020 with my ADN, and I have a bachelor's in healthcare management. I read online that you could have a bachelor's in a different background that's besides a BSN, and then you have to get your 1-year experience to apply to FNU. So I wonder, is that still allowed, or do I have to acquire my BSN, or would you suggest I get my BSN prior to me applying to Frontier University?
Not necessarily. If you have a bachelor's degree and you have a nursing degree, you're an RN, you can apply. And what will happen is you'll be asked to respond to a couple of prompts to talk about what nursing means to you, what you think about research, what you think about different things. So it's called applying by, oh Lord, the word just left me. It'll come back in just a minute. But you can, yes, it is still an option to apply as an RN with a bachelor's that is not a bachelor's in nursing. And we have a lot of people come in like that. All right, Tara, if you can help me, I think, was that Jessica, was that you that I was just talking to?
Yes, that was Jessica. And I'm
yes,
okay.
Sorry. Got a few more questions coming in.
Okay.
The next one was from Cynthia Alves Gray. She asked, do most students finish the program in 2 years?
No, actually, I would say somewhere between 2 and 3. What we have found is even the student who is going full-time, so going with the plan of 2 years, it isn't unusual at all for them to need to take a term off for some reason, or to maybe their clinical side is faster or slower than another one. So I would say between 2 and 3 years is what most people do, because there is built-in flexibility so that you can go faster or slower as long as you're meeting the prerequisites for the courses. And most of our students are you know, they're adults, often with children, often working, and so it's not uncommon for people to choose to do the 3-year plan. And even the 3-year plan is flexible, like you can add a course here or there, or you can slow down even a little bit from that. Those are just suggested programs of study.
Our next question is from Ariel Haddix. She asks, is labor and delivery experience required?
It is not. Labor and delivery experience is not required. We do require that you have a year's nursing experience before applying. Many of our students, about a third at this point, do not have labor and delivery experience. What we have found is that the skills that you need will include some skills from labor and delivery. So it can be beneficial to you to have labor and delivery experience at some point, but they're skills that you can learn. So it is absolutely not required. I mean, I always make a little joke about this, but most of our obstetricians were not labor nurses first. And they finished medical school and became obstetricians and can care for women. Midwifery And nurse midwifery specifically has a nursing component to it that you're getting in whichever field you're in. Now, there are skills that labor and delivery nursing teaches you, but you can learn them also when you're in midwifery school. So it is not required. And there's skills that other types of nursing bring into midwifery.
All right, we've got a few more questions. The next one is from Kara. She is a NICU RN right now who's pursuing a WHNP CNM, and she wanted to know if anyone else has experience in mostly babies and transitioning to birth focused.
Yes, many of our students, as I said, about a third of our students don't have don't have labor and delivery experience at all. Many of them come from, and I'm going to say, sister units like postpartum, our nursery, our NICU. Some come from completely unrelated. We have some students in the program who were ER nurses, or ICU, or even psych nurses. So it is not, I mean, you've heard the terminology, so you're going to come with some understanding of birth that other people that their nursing is completely unrelated may not have, but it's just not, it's not required.
Susan, can I jump in real quick and ask a question related to that?
Sure.
So you mentioned that, I mean, even online it says you have to have the 1 year of experience, but then there's a bullet under that says if you have experience as a childbirth educator, a doula, or lactation consultant, that can sometimes be waived. My first question is, how often does that happen, that someone is admitted into the program with less than 1 year of experience based on those other areas? And then so I guess let me let you answer that one first. How often does that happen?
It doesn't happen extremely often, and I'll tell you why. Our admissions process involves the scoring of your application. Part of the scoring comes from nursing experience. So you get points for certain types of nursing experience. Now, there are also points there for experience as a doula, experience as a childbirth educator, et cetera. But many of our nurses also have that experience. So when we pull out and look at that application and look at our admissions, we admit the top X, however many each term, depending on how many we're admitting to that class. And so it is scored based on the application and the essays that you submit. And so it does occasionally happen, but it is not extremely frequently, because we generally have we have a lot of applicants. And so we score, and the nursing experience, it increases the score on most people's application.
Okay, and for those few cases or those times when it does happen, how much nursing experience, or how is there a certain amount of nursing experience if it's not a full year? Is it like, well, they've had at least 6 months of nursing experience, and throughout their entire time they've been doing these other things? And the reason I ask is because I have experience with all of those things, certifications and stuff, and I'm just concerned about, should I wait or can I go ahead and apply if I only have
you can apply. I mean, you can apply. I can't tell you, I can't tell you what your chances are, because I don't know what the other applicants in the cohort that you would be applying for bring to the table. But I will tell you that all of those things are valuable. I mean, I know that we've had students without that full year, but often it sounds similar to your situation. They have several of those other things. Like they've been a doula for, I'm just making it up, for 8 years, and they've been a childbirth educator for 6 years, and they, you know what I mean? There's several other things that are helping to increase their exposure, so their preparation to come into the midwifery program.
Okay, that makes sense. Thank you.
Because what we want is everybody that comes in to be successful. And so we know that these components help to give you a strong foundation to build your midwifery skills on.
Hello, this is Regina Peavy. I have a question.
Hi, Regina. What's your question?
Hi. Okay. So, once you submit the packet portion for the application, about how long does it take for the university to get back to the potential student?
I do not think we have an admissions officer on here, and I might just be making something up if I told you. I will tell you this. I know that we have deadlines for the applications, and then after the deadline, the applications are reviewed, and our faculty have like a few weeks or so to review them. And then we have an admissions meeting. And so it's usually several weeks, but I'm going to ask you to ask your admissions officer that, because I could just be, making a number up, and that's all it would be, a made up number. I'm sorry.
It's okay. I'll ask them.
Yeah, they're pretty good
Chime in on
knowing
that.
those timelines. Yeah, please do.
Sorry, I just got accepted, excuse me, for the winter, and it took them, they say it'll take about 8 weeks to get back to you, but it could be more.
Okay.
Thank you for sharing that information.
You're welcome.
Thank you. That's our newest panelist. Thank you so much.
Hi, this is Sunny Sarush jumping on the call. I apologize to everyone that I'm so late. I'm doing well. I just ran out of work with everything going on. So I apologize again for being so late to everyone.
Sunny, is your camera up? I can't see everybody's picture.
So I'm outside of work, so I can try and go into a corner and
if you can, that's okay. I'm going to do your introduction, and then we're going to ask you one of the questions that we've been asking everybody so we can get your perspective, okay?
Sure.
All right, so Sunny is a registered nurse and a nurse midwifery student at Frontier, and she is the member of our panel that had a little emergency at work, or a little thing at work that was keeping her from us, but it looks like she's going to be able to jump on now. She was inspired to become a midwife by her grandmother, who is a midwife at the largest public women's hospital in Iran. She is originally from California and has lived in New York City for 10 years. Sunny has a bachelor's in public health from the University of California, Berkeley, and a bachelor's in nursing and a master's in public health from Columbia. She is the recipient of the 2019-2020 New York City Midwife Scholarship, Nurses Educational Fund Scholarship, and Lisa Ross Memorial Scholarship from the American Association of Birth Centers. Sunny has traveled all over the world, has worked as a birth assistant at a birth center in Guatemala and at the renowned Holy Family Birth Center on the Texas-Mexico border. She has also been featured in Vogue, Time Out New York, and Huffington Post for her reproductive rights activism. So Sunny, here's your question. Are you ready?
Yes, ma'am.
Ask our student panelists if there was something that you wish you had known before coming into midwifery school. What would you say that is, and what lessons have you learned during your journey so far?
I think the major lesson I learned is that it's okay it's going to be really hard, and it's okay that sometimes you feel like you're making mistakes and that you can't do it. The most important part is that you pick yourself up and you take yourself out of that rock bottom place when you really feel like you're never going to be a good midwife or you're doing so poorly, and just kind of think about, okay, what did I learn? What am I going to do in the future? And I mean, Dr. Lomax, who's here, has known, she's one of my mentors, that there are just times where I was like, I'm not good enough for this. I'm not good enough. I can't do this job. Like, I'm not strong enough. And then it's like, no, you are. You can do it. You just have to keep pushing yourself, keep learning, and keep believing in yourself. And it's okay to go through that process. And everyone feels like that.
Thank you. So you've added a new word, persistence, resilience, to what we have been talking about. Thank you. That's another slant, but it sounds so familiar. Boy, these lessons are, I hope you guys that are tuning in with us either live or watching it later are hearing these important lessons from our students. I have this slide up here just to give you an idea in the Department of Midwifery and Women's Health, how we're set up, and just to let you know that there are lots of people on your team. I'm the department chair. We have a clinical director. There are course coordinators and course faculty and regional clinical faculty and advisors, professional advisors and financial aid people and credentialing people. And that's not even all the people. We have a lot of people that are at your fingertips Like if there's something I want you to go away hearing that is frontier specific, it is that we're going to surround you with a team that believes in your ability to be successful. And I think that's really important. Do we have any other pending student questions, Tiara?
Yes, we've got a few. So the next one is from Anne Marie. She's very interested in our midwifery program, but currently living in New York. And she wants to know if there's any more information from the state's Department of Education regarding the accreditation renewal and when New York residents will be able to apply.
No, nothing from them. We have stayed close in touch, but as of right now, we do not have an update from them. Thank you for asking that.
And next, we've got two questions about clinical sites. Carol asks, how difficult is it to find clinical sites? And then, where's the next one? And then Christiane asks, for the students, what was the process they used for finding a clinical site? Did they have to call local birth centers or hospitals? And how long did it take to secure those clinical sites?
All right, Cheryl or
Tonya?
Aaron and Sunny, yes, if y'all will speak to that.
So I live in New York City, and this is Sunny, by the way. New York City is a notoriously can be difficult to find clinical sites. There's other schools here, lots of demand, but I think the key is that you really work hard and you really, reach out to people, follow up with people. I got 2 great placements. One was with a private practice midwife with hospital privileges, and one is one of the oldest midwifery practices in New York. And that really was just persistence with asking around, using your network. I mean, of course, you can start with a community map, but think outside the box. If you're having trouble, ask midwives in the community, nurses in the community. Really, follow up that email. Even some people go visit practices, and that's all okay. And, it took me about 8 months. And, if you really, really, live in maybe a high demand state or a high demand area, you can do it. I know I did it. It takes hard work, but I'm so happy that I put in that hard work because I had such an amazing clinical experience. So I would say start early, maybe even a year to 9 months before, and just keep working at it. There'll be, again, get some no's maybe, but then you'll get that yes, and that's where you're meant to be.
Thank you. I want to just say a couple of things about that. First, I want to explain what the community map is to those of you who are not Frontier folks. We have like an interactive clinical map that you can look at to see. To say is that community map is available to our students, and the site may be current or may not be current, but at least gives you some starting places. But you guys are we have found the best clinical site finders, locators, because you know your community. That's what Frontier is all about. Frontier was really started as a school on the mountain. It changed into this community-based education program in the late 80s because we knew there were so many nurses across the country who wanted to become midwives, but who did not have maybe a school close to them, or maybe it was not an affordable university or whatever the case may be. This gave students everywhere, this gave nurses everywhere the option to become midwives, but we don't know every single community. And so you guys know the wonderful providers within your own community and are able to reach out to them. That's the best way to grow your clinical site. And then you're also making inroads into your community, which is the best way to prep up for a job in your community, is to be a great clinical student. Aaron or Cheryl, do y'all have any tips here? And then we'll finish up.
Just real quick, because of how COVID unfolded, there was a lot of ebb and flow in my clinical assignment. It sort of came and it went and it came and it went, and I had to look into other avenues for a little bit. First of all, the why am I blanking on what they are? The clinical credentialing and coordinating people were very helpful, just giving me ideas and giving me a list of, you know, Frontier grads, people that have taken Frontier folks before. It was very helpful that way. Also, I think just if you're able to, not everyone is, but remain flexible on location. Mine is about an hour and a half away from home for me, and it is a bit of driving. And I know some folks who have relocated, they live with their aunt or what have you for a couple of months, so that you can find a place that suits you. So, I mean, there's a lot out there. You might need to just kind of think outside the box a little.
That's a great tip. And you also touched on something I wanted to make sure and say, because one of the things that most prospective students and students early in the program are worried about is finding a clinical site. And we have a whole team that helps with that. We have actually an office now that is dedicated to helping students with their clinical placements. And then you have regional clinical faculty who often know sites within your area that can help you. And then you often are bringing ideas too, and we're able to help you flesh those out. Would that be a site that would work, and what kinds of things would need to be in place to allow for that? Erin, do you want to add something?
Yeah, I would just say, so one thing you can do is if you've had, I asked the 3 midwives who attended my own births and sort of begged them. And so you can use connections just personally that you might have. And then also, I will say Frontier grads like to take Frontier students because they've been through the program. They think they're the best and prepared and sort of have that same mentality. So I live in North Carolina. There is another midwifery program in the state. So I found that Frontier grad midwives were more willing to hear me and to consider me. So I would check out the alumni.
Yes, and we're as the large
early. Very
yes,
early.
early.
Got home from Frontier Bound. Actually, I was a bridge student. So when I bridged, right when I got home, I started shooting emails out. So do it early because they do book out sometimes years in advance.
I saw one other question. There may be others there that just are gone because I popped out and back in. If you're going to do clinical in a different state, you do have to have a RN license in the state that you do clinical in. So you would have to get RN licensure there before you would be to do that. And that happens all the time. It's not uncommon for us to have students that do clinical in other states. Tara, are there any pending questions? If not, I'm going to wrap us up.
Yes, we do still have a few. There's one specifically for Sunny. Robbie Griffin wants to know what birth center you worked at in Guatemala.
So I worked at the ACAM Birth Center in Guatemala. They have a little booth at ACNM every year. I've actually also worked at Holy Family Birth Center in Texas on the border. And I currently work at Jazz Birth Center in Manhattan. And just a little toot for birth centers while we're on the topic. I actually spent my clinical time, my course time, my didactic course time, traveling around the world and doing my courses for Frontier while working in Guatemala and in Texas on the border and traveling also. And I highly recommend getting experience if you can at a birth center because I think it's an amazing part of what we learn at Frontier for physiologic birth, and it's so important. And don't be afraid to ask, will you take a volunteer? Will you, I don't have experience, but I can do XYZ because I volunteered, and I'm so grateful that I got that experience. So yeah, ACAM Birth Center in Guatemala.
Thanks, Sunny, by the way. That's great.
You're welcome.
And then we've got a few more.
Ask about the completion rate. I'm seeing a few of them, Tara, so I'll catch those, and if you'll help me catch the ones that I didn't see before.
Yes.
The completion rate, I do not have the number in front of me, but it's somewhere around 85-ish% of people that start to finish, and I don't want to give you a wrong number, so that is an estimate. I don't have the completion rate in front of me. What other questions, Tara, do we have pending?
We've got a few related to admissions. So Tiffany wants to know, if we apply in November, when can we expect acceptance letters and when do we start classes? I know that someone answered about 8 weeks response time.
Yeah, and I don't want to, I would advise any very specific admissions questions to ask your admissions officer, because I don't want to misadvise you on that. I will tell you one other general thing that people need to know. We go to school all year. So we have 4 terms, which are 11 weeks in length with a couple of weeks in between. And then, so we have a winter, spring, summer, and fall terms. And the semesters are they're actually semester hours. The credits are semester hours done on what appears, like if you look on the calendar, it looks more like a quarter system, but semester hours. So I don't know if that helps y'all or not. What questions otherwise, Tara, do we still have pending?
I am looking for some. Yes, I'm trying to respond to everyone with just redirecting them to our admissions page and then clicking program finder so you can see a more accurate timeline.
Oh, thank you so much.
What expectations that you can have as far as curriculum. Now, there are a couple other questions. Ariel wants to know, is there a wait list? And Sarah asks, is there an option to defer admission?
I'm going to refer both of those questions to admissions. There generally is a wait list, and you can choose not to be admitted, but I don't want our terminology to be incorrect. So talk with your admissions coordinator about if you're not wanting to come, if you've applied for a certain term and are wanting to come another term.
All right, we've got a few more, and then let's see. Dawn Martin, she says that she is just starting CNEP 197 this term. Any helpful hints for night shifters, especially for attending Zoom meetings in the middle of the day?
Well, a lot of our meetings are recorded, but it does help to attend what you can in person. And so I'll guess when you think about scheduling out, making sure you get into that calendar for the courses for the course each term as early as possible so that you can try to adapt your work schedule around it. I don't want you to put yourself, obviously, or your patients at risk by staying up all day and going to work at night and staying up all day and then going to work the next night. But you might find that most of the live sessions are going to be during the week, Monday through Friday weekdays, and you might consider more of a weekend schedule for some of those weeks.
All right, next, Jill would like to know where we can get holistically based birth experience prior to applying other than L&D. She'd like to work in that field to gain experience with labor, but it heavily follows the medical model of birth as opposed to the midwifery model.
Looking for work as a doula or birth assistant or an RN at an AABC accredited birth center or a home birth practice would be a great way to get that kind of view of birth. That would be very beneficial to you.
And then past the admissions related questions, Allison Grant wants to know, I hope this question is not inappropriate or offensive to anyone. Since midwifery does have a physical aspect of long hours and being on your feet, at what age do midwives tend to stop working in L&D, and what work do you do at that point if not ready to retire? I'm afraid I would be entering too late as I do not even have a nursing degree yet.
Well, let's just say that I'm not young and I still work full scope and still do births. It is highly variable, I will say, though. I think it often depends on the kind of practice that a person's in. So if you're in a practice where you have a cohort of midwives or you're not on call every single day, the call is not extremely busy, that's going to make the longevity better for full scope practice. But a lot of midwives, probably, I would say the 15 to 20 years of full scope practice if they're in a busy practice, and then very often will do office work with GYN and OB patients that doesn't include birth, or maybe do just a little birth And so the practices are so very different that it's hard to pigeonhole exactly the shelf life of the career.
Okay, and then next, I'm not sure if we touched on this in the clinical part, but Ashley Gossage wants to know, typically how long does the clinical portion take to complete, and how do you work, or can you?
You can work. It takes most people somewhere around 9 months to complete their clinical. Some people it takes longer. Right now it has taken folks longer because of COVID and being in and out of clinical and having some restrictions, but that's about how long it normally takes. We have to wrap up. So I am going to ask Tiara to send any remaining questions to me in email. And I think you had to register with your email. So hopefully I can get back in touch with you. Or Tiara, if you'll type my email into the chat, I am more than happy to take questions. More than happy for you to send me questions, and I will do my very best to answer them in a timely manner. So thank you all for joining us this afternoon. Thank you to the panel. I appreciate everybody's time. And thank you for your interest in becoming a midwife, or thank you for those of you who are already students. Thank you for your commitment. And it is extremely, I'll tell you this, there's never been a day that I regretted being a midwife.
I agree.
Today, tomorrow, and twice on Sunday. And it is the best job on the planet Earth. It's hard. It can be tiring, but I don't ever think, gosh, I wish I wasn't doing this. I think, oh, I wish there were more hours in the day. I wish I didn't have to sleep. Those are the kinds of things